Hi, I'm Adam Putnam, and I'm proud to represent Florida's 12th District in the U.S. House of Representatives. You know, August was an important time in the history of this country, and it resulted in the people taking back from the Congress control of this debate about the future of health care and the relationship between government and its people. One of the biggest flashpoints in this debate about health care reform is known as the public option. And over August and through the phone calls and letters that we receive in this office, there's a lot of questions about what is the public option and how will it impact me and my relationship between my doctor. So first of all, let's just talk about what the public option really means. The public option, even according to the sponsors and advocates of President Obama's health care reform bill, is a first step towards socialized medicine. It is a first step towards a single-payer, government-run system. Now, how do you get there? Does the law say that you have to go into a government-run program? It does not. But it sets up a set of events where the logical conclusion in a very short period of time will be for the government-run health care plan, the government insurance program, the so-called public option, to be the dominant health care plan in the country. And that happens because how can private insurance markets compete with the government? How do you compete with someone with limitless pockets and an ability to undercut competition? In the state of Florida, we have in the property and casualty insurance something called Citizens. It is a state-run property insurance company. No one, by law, is forced into it, and yet 10 years into that program, it is the largest insurer in the state of Florida. And it's because the other private insurance companies have been crowded out to the point where the only option available to them now is the public option. The same would be true in America if we were to adopt a public option in health care reform or in health insurance reform. They don't have to mandate that everyone go into that program for that to be the end result within a decade. It is very important that as this healthcare debate proceeds, that we not allow the public option to be a part of that debate, because when it is, it guarantees that we are taking the first steps toward a single-payer system in this country and driving out private insurance, driving out choices for you and your family about who will be your insurer and who will be your doctor, and leading us toward a Canadian or a British-based healthcare system. That's not what I want in the United States, and that's not what my constituents want for this country, based on what we heard throughout August and since then. So that's sort of the basics of what that public option means for you and what it means for this country if it ends up in this bill that is being debated here in the Congress on health care reform. Thank you very much.